On this Monday night, growing fears of that fast-spreading coronavirus variant. The criticism the feds are acting too slowly.
This virus knows no borders.
As Ontario changes its policy on reserving vaccine doses. The demands for tougher action at airports.
Rapid testing should be rolled out at every international airport across the country.
As anxiety flies higher, Saudi Arabia sentences a women's rights activist to prison.
That they consider women's rights activism to be an act of terrorism.
The campaign for her release and her connection to Canada. Plus, the commitment and courage of essential workers.
You're making a real difference.
A salute to the pandemic's unsung heroes.
Global National with Donna Friesen. Reporting tonight, Farah Nasser.
Good evening to you and your family. Thank you for being with us. On a day when Canada's COVID-19 death toll topped 15,000 people, there are now growing concerns about the arrival of a more contagious variant of the virus. Canada has at least 5 confirmed cases of the variant. Alberta reported a case just this afternoon. All have some connection to travel to the United Kingdom, where the variant was discovered earlier this month. The federal government now facing calls to increase screening, to further limit non-essential international travel, and to speed up the vaccine rollout, which was largely halted over the holiday weekend. Oxford University is tracking the number of vaccine doses administered worldwide. As of Sunday, Canada had administered about 52,000 doses. That's fewer per capita than Israel, Bahrain, the UK, and the US. While parts of this country are still waiting to receive their first vaccine shipments, Global News has learned Canada's biggest province says it's changing its policy and no longer going to reserve doses for second shots. Here's Abigail Bimman.
With no readily available national vaccination picture, the COVID-19 Canada Open Data Working Group built its own.
Quebec, for example, has rolled out the vaccine in just about every part of the province, if not every part of the province.
But Ontario is being criticized for cutting capacity over the holidays, concern heightened with cases of the new UK variant now in Canada.
It's not good optics to have these clinics shut down for a number of days when we're being asked to keep making significant sacrifices.
Ontario says the pandemic exacerbated staffing challenges, and it was hospitals that asked for an amended schedule. But the health minister's office tells Global News they expect to get all their initial 90,000 Pfizer doses into arms in the next several days. And in a change to their initial policy, they will no longer reserve second doses. Meanwhile, the federal health minister's office tells Global News Moderna vaccines are arriving in the Northwest Territories and Yukon Monday, 7,200 doses each. The rest of the first 168,000 doses will roll out to provinces and territories this week.
I think they have been moving too slowly. And, this virus knows no borders. It knows no jurisdictions. It knows no holiday time.
Federal opposition parties are calling for more data around both vaccines and genome sequencing to find variants.
I don't understand why Canada isn't able to vaccinate at the same rate as countries like Israel or, the United States. Other countries around the world, I think, are ahead of us on that. And really, the federal government needs to explain why.
Really roll out the vaccine or vaccines now, actually, as quickly as possible.
President of global research group CFAR and a member of the federal government's vaccine task force, Dr. Alan Bernstein says we should be doing several things in the face of the new variant and be prepared for other variants, including ones that develop here in Canada.
We need to do a lot more DNA sequencing. We need to understand if there are new variants, what their properties are. We need to up our game on contact tracing.
The Liberals are defending their vaccine plan. The health minister's office telling Global News their, quote, approach is delivering, putting the onus on the provinces to get them out as fast as possible, but offering few details about how many doses are going to them and when. Farah?
Abigail Bimman in Ottawa. Thanks, Abigail. Canada's restrictions on flights from the United Kingdom to limit the spread of this new variant are going to be in place until at least Sunday. Ontario Premier Doug Ford called for the federal government to begin testing incoming passengers for COVID-19 at Canada's busiest airport, threatening to go at it alone if necessary. But 1 week later, there's no sign of any change in procedures at Toronto Pearson International Airport. But as Sean O'Shea reports, an airline union says the time for action has come. Sean.
It's been a week since the Premier of Ontario demanded that the federal government start testing arriving international passengers for coronavirus here at Toronto Pearson Airport. But that hasn't happened yet. But one airline union says it should, and soon. At Canada's busiest airport, it's been a week since Ontario's Premier declared this.
Our borders are like a sieve, like a spaghetti drainer. No, they aren't getting checked.
Premier Doug Ford claimed that cases of COVID-19 are not getting detected because incoming passengers are not tested when they arrive.
Stop the leak. It doesn't matter if there's 10 people getting through. That's 10 too many that are going to be out in the community spreading COVID.
Now, one airline union says the time for rapid testing is overdue.
Rapid testing should be rolled out at every international airport across the country.
Sunwing pilot and union president Barrett Armand points to Calgary International Airport, which brought in testing almost 2 months ago. Instead of a 14-day quarantine, the isolation period in Calgary can be as little as 2 days, although travelers must remain in the province for 2 weeks.
It's huge. The industry could actually resume, which I believe is what the federal government wanted.
The airline industry believes testing would make travelers more confident about taking a trip, but that's something governments have discouraged during lockdowns.
People are still traveling, and as long as people travel, there is a need for rapid testing.
The union wants Ford to follow through on a promise to test. A provincial government spokesperson told Global News it's urging the federal government to urgently partner on testing, or else the Ontario government is prepared to act on its own.
If they want to help us, well, we'll be doing ride checks on the side of the road as people exit, because we're not putting people at risk here at Ontario.
The federal government maintains that only about 1.3% of all known coronavirus cases in Ontario originated with travel outside the country. As for when testing will begin, neither government is saying. Farah.
Sean O'Shea at Pearson International Airport. Thank you, Sean. Now, Canada is one of several countries restricting travel to the United Kingdom, which just recorded more than 40,000 new cases. It is the biggest single-day increase of the pandemic there. The highest infection rates there are in and around the London area, where the majority of these new cases are believed to be caused by the more infectious new variant of the novel coronavirus. As Redmond Shannon reports, that's putting further strain on the healthcare system there.
Verbier, Switzerland, popular with affluent British tourists, including the likes of Prince William. But when scientists said the new UK variant of the virus may be more infectious, Swiss authorities imposed a 10-day quarantine on skiers who arrived from the UK. Reports that 200 of them escaped quarantine caused understandable outrage.
There are many indicators that show that this number is totally wrong. The first one is that we have statement from the police that all the controls they have done were done with satisfaction.
Swiss authorities don't know how many, if any, skiers broke the rules, but the story also raises questions as to why any British people were going to Switzerland when non-essential travel was being discouraged.
Infection rates in the UK are highest here in London and in surrounding areas. More than half of new infections in this region are thought to be from the new variant of the virus, and the healthcare system is creaking under the pressure.
The London Ambulance Service said that Boxing Day was one of its busiest days ever. On Monday, new daily infections in the UK passed 40,000 for the first time, although that figure includes data from the 3-day Christmas weekend. Just as it did with China, the World Health Organization is asking for the UK not to be made a pariah by other nations.
Only if countries are looking and testing effectively will you be able to pick up variants and adjust strategies to cope. We must ensure that countries are not punished for transparently sharing new scientific findings.
But South Korea is extending its travel ban from the UK after it joined the list of countries to have found their first cases of the new variant. And Japan has now banned all non-residents from travelling to the country until at least the end of January. Redmond Shannon, Global News, London.
South Africa is now the latest country to surpass 1 million confirmed COVID-19 cases. And the grim milestone comes just 9 days after the country reported 900,000 cases. Officials say the second wave surge is being fueled by school holidays, public indifference, and a different, potentially more infectious variant of the virus. South Africa is the worst hit country on the continent. A Chinese journalist has been sentenced to 4 years in jail for her reporting during the early stages of the pandemic. Zhang Zhan was convicted of picking quarrels and provoking trouble. The 37-year-old traveled to Wuhan in February to cover the coronavirus outbreak. She posted on various social media platforms. Zhang was arrested in May and accused of spreading false information. She's believed to be the first person to be tried and sentenced for reporting on the virus. Her first-hand accounts painted a more dire picture of the situation than the official narrative. A prominent women's rights activist with ties to Canada has been sentenced to nearly 6 years in jail in Saudi Arabia. Loujain al-Hathloul has been found guilty under the country's broadly worded counterterrorism law. The 31-year-old's case and her imprisonment have sparked criticism all around the world. And as Ross Lord explains, her supporters want the Canadian government to intervene.
The actions that got 31-year-old Loujain al-Hathloul locked up in Saudi Arabia are things Canadians consider basic human rights, like driving a car and campaigning against female oppression. Al-Hathloul is a graduate of the University of British Columbia. She lived in Canada for 5 years. She's been in a Saudi prison for 2.5 years, alleging she's been tortured. Now, her prison sentence of almost 6 years has intensified international outrage.
What they have done is to now state to the world that they consider women's rights activism to be an act of terrorism.
Her sister says al-Hathloul cried when she heard the sentence. She says her sister will appeal and ask for another investigation regarding torture. As human rights activists call for al-Hathloul's release, her former school, UBC, says it's written to the Canadian government to intervene, something her supporters suggest should have been done long ago.
In every type of negotiation between governments, there is always a room to negotiate human rights issues. And I believe that Canada could play a major role.
Others say Canada's influence on the Saudi kingdom is limited, especially when al-Hathloul is not a Canadian citizen.
It's even a little more delicate right now because our diplomatic relations with the Saudi government are not in a very good state of repair. So this is one where Canada is best off allying itself with other governments to denounce these human rights abuses.
The United Nations Human Rights Division has posted the prison sentence is deeply troubling. The UN says we understand early release is possible and strongly encourage it as a matter of urgency. There are reports the Saudi court has structured the prison sentence so that al-Hathloul could be released on conditions within months. Supporters hope that's the case, but they're reluctant to believe it. Ross Lord, Global News.
Late this afternoon, Global Affairs Canada issued this statement saying al-Hathloul's conviction and sentence is deeply troubling. It goes on to say Canada advocates for her early release. COVID-19 tightens its grip on the United States. Coming up, what doctors and nurses fear as hospitals run out of room. Plus, secrets resurface. A little girl's diary discovered decades later. The pandemic has hit the U.S. hard. 1 in every 1,000 Americans has died of COVID-19. The staggering toll of more than 330,000 deaths is unmatched by any other country. Hospitals in some states are already pushed beyond their limits. And as Jackson Proskow explains, there are fears that things are going to get much worse.
California's hospitals are in critical condition, overburdened with COVID-19 patients. With zero ICU capacity left, the sick are being treated in parking lots and cafeterias.
It feels like we are working hard every day trying to save lives, and it's just falling on deaf ears. We will take care of you. We'll find places. We'll put you in hallways. We'll put you in conference rooms.
The next step may be to start rationing care based on who is most likely to survive.
we might be days away from that. And people that are returning from the Christmas holiday are going to start feeling ill in the next few days.
Holiday travel risks creating a viral wildfire. 1.2 million travelers passed through U.S. airports on Sunday alone, the highest number since the start of the pandemic, at a time when the virus is everywhere.
As we get into the next few weeks, it might actually get worse.
December was the deadliest month of the pandemic in the U.S. January could be even worse. And there are fears that a new, more contagious variant of the virus detected in the U.K. is circulating unchecked on American soil.
I do think it's probably here. We don't know. We're not monitoring for it in the way that the UK and other countries are.
All right, here we go. All the while, the great hope, a vaccine, is rolling out much slower than expected. The Trump administration's Operation Warp Speed had promised to deliver 20 million doses by the end of 2020, 3 days before the new year, and only 2 million people have been vaccinated.
There's no doubt about it that things are going a little bit more slowly than we want.
Too little, too late for the thousands of dead and for the severely ill. In San Antonio, Texas, COVID-19 patient James Telshik is now waiting for a double lung transplant.
The disease will keep trying to pull you in, and you just gotta keep fighting it.
In this fight, doctors warn the toughest days are still to come. Jackson Proskow, Global News, Washington.
Ahead, nearly 40 years later, a secret notebook is secret no more. But where is the young writer now? The Canadian Press has named Canadian soccer captain Christine Sinclair as its Female Athlete of the Year, netting her second Bobby Rosenfeld Award. The honor caps an all-time record-breaking year for the two-time Olympic bronze medalist after she marked 186 overall international goals. That is the most of any soccer player in the world. A holiday miracle this past weekend surrounding the top-secret diary of a 10-year-old girl. Nick Gunz, who happens to be a historian, found this notebook in the crawl space of his parents' Toronto home. It came with a dire warning: do not read. Gunz didn't. He just flipped through it for a name and an age. Turns out it belongs to a girl named Allison Jenkins. In 1983, he posted a photo on social media and he found her. Jenkins is now a singer-songwriter and a music teacher living in Vancouver.
The week after Christmas can be a little bit of an anticlimax, and so to have something like this to kind of keep me busy and keep me amused, it's been lovely.
I mean, just hundreds and hundreds of people came online to take this on and help and find a person, and that's just so reassuring.
The notebook will be mailed out to Vancouver tomorrow. Next, recognizing the everyday heroes still risking their safety to keep all of us going. "2020 is the year thousands of people perfected the WFH experience, working from home. But when you really think about it, that's a privilege. Essential workers have to show up in person to keep this country functioning, keep us fed, and keep us alive. Donna Friesen reflects on their role in this pandemic.
So much of our humanity rests in our hands: who we hold, how we comfort, and how we use them for work. Among the heroes of 2020 are those in the eye of the storm, the doctors and nurses. For them, every day is about life and death. It is as demanding and essential as it gets.
In those moments where there's high stress, you know, every family member just wants to be there holding their hand, and they can't.
In the spring, we began to salute them, using our hands to applaud them.
For these heroes, getting up every day, getting back in the fight, getting back to the front lines comes at a great price. It comes with a personal sacrifice. Nevertheless, every day, these brave men and women show up.
And it dawned on us, healthcare workers aren't the only ones using their hands to help us.
If you're working in the grocery store during the pandemic, I want you to know you're making a real difference.
I'm sure it hasn't always been easy for you, but your work is essential.
Thousands of others are doing essential work too. When we hoarded food, they kept the shelves stocked, kept the checkout lines moving. Thousands of people doing work that isn't glamorous or well paid, risking their own health to serve us and help us.
Our social workers, transition house staff, our home care workers, and all those trying to assist people in need. When you're out on the street rescuing women or children, or feeding the hungry, or providing support to the disabled community, a lot of their work is still face-to-face, and they are still showing up every day.
Showing up to care, feed, and comfort our elders in care homes, to deliver our packages, drive the buses, collect our garbage, teach our children. All of it hands-on work that keeps our world in motion and integrates so seamlessly into our modern lives, we tend to take it for granted.
I hope that one of the things that this pandemic has taught us is that people who do some of the work which is most essential for our literal survival are among the lowest paid people in our country.
It is a question of value. To quote Oscar Wilde, do we know the price of everything and the value of nothing? When this COVID crisis is over, there are deeper questions to tackle about the worth of heartfelt, hands-on work. For now, what we offer those doing essential, exhausting work is profound gratitude. Donna Friesen, Global News.
And that is Global National for this Monday night. I'm Farah Nasser. Tonight's Your Canada is Peachland, British Columbia. Thank you so much for watching. Take care of yourselves and each other. Have a good night.